Welcome everyone. It's a great pleasure to be here today to present this webinar with an amazing panel of guest speakers, which are world-leading experts in the lifestyle medicine. I am Dr. Ejaz and work at King's College Hospital in the Liver Institute, which is an official collaborator within GLI for International NASH Day. This webinar today is to understand about the importance of lifestyle medicine in the management of NAFLD. So I have today Professor Mike Trunnell. Mike is a professor in metabolism and lifestyle medicine at Newcastle University, and he has a special interest regarding the changes in lifestyle and how they can impact health. We have Professor Shira, who's Dean in the University of Haifa in Public Health, Israel. And I'm so grateful because I know the timing, there's a time difference zone, but I'm so grateful you can join us, Shira. She is an expert in epidemiology, a researcher, a nutritionist. And today we are going to hear about her presentation and talk regarding the nutrition and management of NAFLD. Dr. Kate Holsworth, she's very kindly presented her work and I'm going to add that in the webinar. And her field, she works in Newcastle University. She's a physiotherapist, a clinical lecturer, and for the last 10 years, she has worked in the area of lifestyle changes and management of NAFLD. So Mike, over to you. My first question to you will be, how can you convince us that lifestyle can manage early complications or early progression of NAFLD? What is your experience and what tips you have to give us?
So thanks, Seema, and thank you very much for the invitation to come and speak today. The thing I find interesting about NAFLD and NASH is how well it responds to lifestyle changes, and yet how it hasn't really translated into something that we do routinely in clinical care. Now, there's a really key reason for that, and it's because if we go back 10 years, the science underpinning the use of lifestyle medicine, so diet, physical activity, and sleep, in liver disease was really small. And what I wanted to do was just walk you through a couple of things around that to show you that although the evidence today is really strong, if we go back even 8 years, the evidence, although really promising, wasn't quite as strong as it is now. So we shouldn't be beating ourselves up for being a little bit behind the curve, but what we have to do is catch up now. And as we're in the middle of COVID-19 and most of us are in isolation, this is a great time for us to reset our expectations of how we provide services for people living with liver disease. And also it's a great opportunity for those people living with excess fat in their liver or liver fibrosis to be looking at resetting their behaviors too. So hopefully, if I do this right, you can see my screen. Can you see that okay, guys?
Perfect.
Great. So this is what I was alluding to. So this is the first systematic review that we did looking at the effect of diet or exercise or both about 8 years ago now. And they're looking, these are the numbers of people who've taken part in clinical trials. So they're not the number of trials. So only 18 people had taken part in a research study looking at diet only 19 people of exercise only. Now, I was really privileged to work with Shira and also Romero on an updated review for that now. And it's great to see that 8 years later, or 9 years later when we actually did it, the field is completely different. But the root of this is really around, does diet or exercise or both come together? And also then which is best? And this is some data that we've done from the UK Biobank, and it's a simple data set that says, well, what's the behavior of people? Do they do they behave differently if you have liver disease? And what you can see here are the number of people who have good behaviors in the green area or poor behaviors in the red. And this is looking at sleep, sitting, and physical activity. I'll let Shira talk about diet. And you can see that if you are healthy and you don't have liver disease, you tend to have a good night's sleep, which is 7 to 8 hours, low sitting time, and you're moderately physically active. But you can see that as you start to look at liver disease or more advanced liver disease, behavior changes. People sit more, physical activity levels go down, and sleep is disrupted. Now, people are sleeping less. Now, the key question here is, which comes first? Do you develop liver disease and then your behavior changes, or the other way around? Now, the most recent data that we've got is that it's a mixture of the two. But what it does show is that there is a key opportunity for us to look at this. Now, this is a comparison of probably the question I get asked most is it better to eat less or move more? Now, as Kate will show you, that it isn't all about liver changes, but actually exercise does good to the heart and the brain. So it's a little bit of a simplistic question. And as Shira will show us, that it's not just about how much food you eat, it's the types of food you eat. But what's quite interesting here is that this is the change in liver fat with an 8-week exercise program. It was actually one that Kate led. And this is a change in liver fat that is actually clinically significant. It's about a 15 to 20% reduction in the amount of fat that you would have inside the liver. Take home is exercise worth doing? Yes, it's great. But if you compare that to weight loss of about 8% with a very low calorie diet, where you see an 80% reduction in liver fat, actually the effects on the liver are quite modest. So if you're looking purely at should you eat less or move more in terms of liver health, eating less trumps moving more. But moving more does something different. It helps the heart, it helps the brain in a different way to diet. So should we be taking this seriously? Absolutely. And if we have a look at some of the work from Villa-Gomez, they've shown prospectively if we can start to get weight loss into routine care, it has a profound effect on not just people with early stage liver disease, but people with more advanced liver disease, where you could actually look at NASH resolution or NASH remission. And that should now be our new gold standard, that actually can we start to reverse this? And that's at a time when the medicines we have available are pretty scant. And I was really privileged to be part of a team that worked on type 2 diabetes remission and showed the percentage remission with increasing amounts of weight loss. And I think this is now sustainable, and we should be looking at putting NASH and NAFLD into remission in the same way that we now talk about type 2 diabetes remission. And the really exciting thing for me here is how do we begin to scale that? And we've started to see now how you can use digital technologies. So this is some data from Kate showing that you can use digital technologies as a way to support weight loss and weight loss maintenance away from the clinic. And as we're beginning to embrace the new normal of remote management, so that we have the patients who really need to be in secondary care, but those who we can keep away and we can manage away from the hospitals, we should be doing that. So I think this is a hugely exciting time for liver disease management. What we've seen is an acceleration in the evidence base over the last 10 years, to the point where the research that Kate's doing is showing a great effect of exercise and physical activity in preventing and beginning to reverse liver disease. And the work that we're seeing around nutrition shows very similar effects. So yes, we should be embracing this. The question is no longer whether it works. The question is, how do we scale that? I personally think digital services are a way for us to do that, particularly when liver doctors and the teams around them are not trained like they are in lifestyle medicine. an exciting time. Evidence is caught up. The challenge for us is how do we implement?
Thank you, Mike. Thank you so much. So very interesting data. And this is actually what we are seeing in the clinics. So when I have been doing my clinic and I did an audit for 1 year, the patients which were given proper guidance, they were losing weight on every visit, 79% of them. And this led us to, the formation of a patient support group, because we cannot see the patients so often in the clinics. But then it's like, having meetings, having these different apps, having access to the patients by video conferencing and things, so that they're able to maintain weight. So Shura, coming to you now, you have a vast experience in the field of nutrition, and I know you have your presentation, which we are going to add to this webinar later on. You have given a very detailed, how we are going to manage the patients, what are the different lifestyle dietary advice. But in short, what do you recommend to the patients? What sort of, because that's the first question, which diet is beneficial for us, not only for losing weight, for weight maintenance? And what do you recommend as clinicians if we don't have nutritionists in the clinics? How should we guide our patients?
Well, first of all, thank you very much for the invitation. I'm very happy to be here. And well, it's very difficult to summarize, the whole clinical aspects in a couple of minutes. But I would like to emphasize the fact that a healthy diet helps to reverse liver fat and to reverse liver inflammation and even liver fibrosis. Which type of diet exactly? It doesn't matter. It should be tailored to the patient's preferences, culture, and it should be discussed with the patient. It can be a kind of Mediterranean diet. It can be low carb diet. It can be intermittent fasting. I mean, the patient has the right to choose the diet with us, with the physician and with the dietitian. And we don't need to say that one diet is better than the other. It's all okay, as long as you get some weight reduction, if weight reduction is needed, and as long it's low in sugar and fructose and saturated fat, high in vegetables, fish, low-fat dairy products. As long as we keep these major principles, the patients can choose their diet. They do need to see a dietitian or physician or some kind of support on a routine basis. And if you look at the obesity treatment guidelines, then you see that the guidelines recommend at least once a month. So there should be regular contact with the patients. They need it, otherwise it won't work. And I would like to add something about Mike said about physical activity, that when you look at successful lifestyle modification programs, it always includes both diet and physical activity. So you can't really separate the both. And we know that even for weight maintenance, once patients achieve weight reduction, but now they reach the stage of weight maintenance, which is even more difficult, then we know from the guidelines and from the clinical experience that doing regular physical activity is crucial for weight maintenance. At least 150 or even 200 minutes per week of regular physical activity, moderate regular physical activity. Mike, do you agree?
Absolutely. Which is best? Well, actually both. And I think this view that you do one or the other is something that we have to get away from. And the thing I really like about lifestyle medicine is it looks at the individual, it looks at their diet, their physical activity, and their sleep, and these things are interrelated. So although I come from an activity and exercise background, it's really heartwarming to hear Shira from a dietetics background talk about the interaction between the two, because I couldn't agree anymore.
I would even add to it that there is a recent clinical trial showing very beneficial effect of Mediterranean diet in NAFLD patients. But when Mediterranean diet was combined with physical activity, there was an interaction actually between the two, and the effect was much greater. And it led to 80% reduction in the amount of liver fat once the Mediterranean diet was combined with physical activity, much greater effect than diet alone.
Thank you, Shira. And I think Kate's presentation summarizes all these points, and she has very interesting data which shows that, you know, it doesn't even depend which type of physical activity or exercise you are doing. It can be aerobic, anaerobic, strengthening, core strengthening, anytime, any type of exercise. It's like the continuity in having physical activity, which is movement versus sitting down, which is much more effective for management of NAFLD. So I think I will add this presentation, which is like a good source of all the information regarding the physical activity. And Mike, turning to you, just summarize, what is your experience in the lifestyle medicine and NAFLD, and how would you suggest that we take next steps for the future?
I think that we're at a pivotal time now. So in the post-COVID new normal, there's a need for us to embrace lifestyle medicine and liver disease like never before. Now, we have a problem here because the teams that are currently servicing and supporting people with liver disease are not trained in how to provide, and the system isn't set up in providing the type of weight maintenance, physical activity and exercise. So what we need is care teams and people with liver disease to come together to look at how we redesign our service pathways. And I think the key take-home message from this is, which exercise is best? The one that you'll do. Which diet is best? The one that you will do. If you can do the two together, your chances of success are higher. But most importantly, it's easy to lose weight for 2, 3, 4, 5 weeks. The real challenge is keeping it off. And I think that's where targeting behavior in the general sense is really important. And I think that our configuration of our teams should improve as well, because we need to acknowledge the responsibility of patients, and patients who've lost weight or moved more or sleep better are the best advocates for lifestyle medicine for other people with liver disease. But we also need to acknowledge the importance of allied health professionals like dietitians, physical activity specialists, physiotherapists, and behavior change in our care pathways. And once we do that, we can allow patients to get the right care at the right time for them. And that won't always mean meeting the physician as the first point of call. It might be meeting somebody else first. An immensely positive time for us. The science is really strong. You're starting to see alignment between professionals around the importance of lifestyle medicine. And at a time when the number and quality of medicines available for liver disease are very low, we have to embrace this now, because there are no other treatment options for us that are available at scale to everybody with liver disease.
Thank you so much, Mike. And I know you have done amazing work in the digital area for diabetes patients. I hope something is coming for the NAFLD patients as well in near future.
I'll watch this space very definitely.
Yeah. I'm so grateful, Mike, Shira, Kate, for your time and for information that you have shared. Thank you so much.
Thank you so much for the invitation.
Thank you, Seema. Thanks, Shira.
Thank you. Bye-bye.
Bye.
Thank you to the organisers for the invitation to present as part of this webinar. So I'm going to talk to you about physical activity and exercise in the context of NAFLD, and I'm hoping to provide some tips to enable you to become more active if you're a person living with NAFLD, or if you're a healthcare professional in supporting your patients to increase their activity levels. So physical activity and exercise are commonly recommended as part of the treatment package alongside weight loss and dietary change. But what is the difference between physical activity and exercise? So physical activity is any activity that requires you to use more energy than resting, and it incorporates many of the activities you carry out as part of your day-to-day routine, normally without even thinking about it. Exercise is a subcategory of physical activity in which planned, structured, and repetitive movements are performed to maintain or improve fitness. The main types of exercise that have been studied in relation to NAFLD are aerobic and resistance exercise. Aerobic exercise strengthens your heart and lungs and improves the way your body uses and handles oxygen. It normally uses the large muscle groups, and it's the type of exercise that makes you become a little bit hot and sweaty, and it normally lasts for about a minimum of 10 minutes. Resistance exercise is any exercise, it basically helps to strengthen the muscles, and it's any exercise where your muscles contract against a force or a load. So examples of resistance exercises are lifting weights, using resistance type bands, and using your body weight as a load. So things like press-ups would be resistance exercise. So let's have a look at some of the physical activity data for NAFLD. So this is a study we carried out, and we objectively measured physical activity levels in our patients with NAFLD over 7-day periods. And we compared those to age and gender matched healthy controls. And we found that on average, people with NAFLD took 1,700 steps per day less than those without NAFLD, which doesn't sound like a lot, but then if you add that up over the course of a week, it's around about 10 kilometers that they were walking less if they had NAFLD. And people with NAFLD spent much more time inactive than healthy controls. So they spent an extra 5 hours each week either sitting or lying down during waking hours. And it's not just the total amount of activity time or inactive time that's important, it's actually how that's spread over the course of the day. So here are two activity profiles. On the left, you have a lady without NAFLD. On the right, you have someone with NAFLD. And it covers a 24-hour period on the x-axis, so starting at midnight, ending at midnight. The red spikes are total energy expenditure. The green spikes are steps. So you can see that the lady without NAFLD has performed a lot of activity over the course of the day, compared to the lady with NAFLD that has much longer periods of inactive time and much shorter and smaller peaks of activity. So increasing physical activity throughout the day and reducing sitting time is important if you have NAFLD. It helps to improve your metabolic control, it reduces your risk of cardiovascular disease and diabetes, and it burns more calories. So it's really useful if you're trying to lose weight or maintain weight loss. So structured exercise is one way of increasing physical activity levels. So what does the data look like for NAFLD? And what type of exercise should you be doing? Well, the simple answer is it doesn't really matter what type of exercise you do. So there was a systematic review and meta-analysis carried out in 2017, and it compared all the different exercise-only studies. And they were studies that had exercise on its own without dietary change and without weight loss. And what they found was, regardless of the type of exercise people performed, there was a relative change in liver fat in the region of 20 to 30%. Now that's a really nice message for patients, people with NAFLD, and for healthcare professionals, because it actually doesn't matter what type of exercise you do. It starts to give you an element of choice around what type of exercise you would like to try performing. And it's worth just noting that resistance exercise, although it yields a slightly lower impact on liver fat, it actually has a lower cardiorespiratory demand. So resistance exercise is often accessible to people that are more deconditioned or that have other comorbidities that prevent people from participating in aerobic exercise. So resistance exercise can be a good starting point. What are the other health benefits of becoming more active if I have NAFLD? And there are lots. So one of the main benefits of you becoming more active and exercising if you have NAFLD is a reduction in the risk of developing cardiovascular disease. And this is through an improved fitness of your heart and lungs and a reduction in blood pressure. Exercise also improves your glucose control, so it can help to prevent you developing type 2 diabetes, or if you already have type 2 diabetes, it can improve the way your body handles blood sugar or sugars in the blood. And we can see a change in body composition. So there's a decrease in overall body fat and an increase in muscle mass. There's also a reduction in the amount of fat circulating in the blood, and because your body has an increase in muscle mass, it has an improved ability to burn fat, which obviously means there's less fat arriving at the liver or other organs to be stored. Your muscles and bones can become stronger, so this is also important, especially as you get older, because you can start to develop thinning of the bones or osteoporosis or sarcopenia where your muscles weaken, and this is a way of preventing that. And also, again, this is really important as a lot of people with NAFLD suffer from anxiety and depression, and exercise and physical activity has been shown in multiple studies to help reduce anxiety and depression and improve mood. And also remembering that exercise is really good at helping you to maintain weight loss in the long term. So if you've made dietary changes, then exercise is really good at helping to keep the weight off. So how much physical activity should you be aiming for each day? Now, it's important to say that there really aren't any specific NAFLD guidelines for the amount of exercise. So the general health guidelines would recommend a minimum of 30 minutes moderate intensity aerobic exercise on 5 days a week, and then resistance exercise on at least 2 days per week. What's more important is setting yourself an achievable goal and trying to gradually build up to this, because it's worth acknowledging that many people in the general population without chronic disease do not meet these guidelines for physical activity and exercise. But just remembering, the more physical activity and exercise you do, the better. So if we're targeting moderate intensity activity, this is just the way you should be feeling. So your heart should be beating faster, you're breathing faster and harder. You should feel warmer, and you should be able to talk, but you can't hold a full conversation. So they're just quite a good guide as to whether you're working hard enough or not. So where are you going to start with all this? You've decided you want to become more active, but how do you get started? I think what is important is just thinking of where you are now. So what's your kind of baseline level of activity? What do you currently do? Do you spend most of the day sitting, whether that be at home or at work? Or actually, are you quite active already? That just gives you a marker to know where you're moving forwards from. And then thinking about other things. So are you restricted due to other health issues? What have you enjoyed in the past? Because it's likely that you probably will enjoy that moving forwards again. And what opportunities are available for you out there in the local community to take part in physical activity and exercise? So you've got your baseline, you've kind of figured out where your current activity levels lie, but how can you motivate yourself to become more active? One of the key things is finding something you enjoy and finding something you can integrate into your day-to-day routine. If possible, find someone to do it with, and people that have exercise or physical activity buddies generally find that they adhere to their exercise or physical activity plan in the longer term. Set yourself SMART goals, so be quite specific with what you want to achieve and make sure they're measurable and they're achievable and relevant to you, and that you have set a time limit on when you're going to achieve these goals by. So just an example might be that I'm going to go swimming twice a week, and I'm going to do 10 lengths each time I go. It'll be at my local pool, and I'm going to do that for the next month. And you can see that actually we can quite easily tick off whether we've achieved that or not. Action planning links into setting your SMART goals, and it's just you trying to commit to what you're going to do, where you're going to do it, who you're going to do it with. Actually, writing this on a planner is really useful, because we know that people that commit and write plans down are much more likely to follow them through. And have a think about what barriers there might be to you becoming more physically active. It could be linked to cost, so finding free or subsidized exercise programs might be useful. It could be, at the moment, a lot of the facilities are closed due to COVID, so it's thinking of what you could do if you can't access a leisure centre or a swimming pool. And coping planning, so it's just thinking about, if a barrier does crop up, then what are you going to do? So one example might be that you've decided to undertake a walking program. So you get up one morning and it's chucking it down with rain, What are you going to do then? It might be that you're going to exercise in the house, or it might be that you're going to go swimming. It might be that you're happy to go out in the rain, but it's just thinking of your plan B so that you stop yourself going off track. And these are just some really simple ideas for increasing your physical activity levels. You can see the things that you can integrate into your day-to-day routine. And the key thing is short bouts of activity can be just as good as long periods of activity. The more that you can accumulate over the course of the day, the better. And here, just to leave you some practical tips for those clinicians watching this webinar to support your patients to make lifestyle changes. One of the key things we found is actually a lot of patients don't really understand what NAFLD is, and maybe hadn't even heard of it before they'd received their NAFLD diagnosis. So explaining carefully what it is, but also that it's linked to lifestyle, but it can be reversed or improved with making small long-term lifestyle changes. Set smart goals with your patients, but make sure that they're the patient goals, not your goals. So they need to be negotiated, but they need to be pertinent to that patient sat in front of you. Encourage patients to self-monitor. So things like food or activity diaries are really good, or activity trackers, because we know that people that self-monitor their lifestyle change are much more likely to continue it in the longer term. And then become aware of what you've got available to you out there in the local community. So are there exercise groups you could refer your patients onto? Are there weight management programs, walking groups? Become au fait with what online resources are available and might be suitable for your patients. And then just finally, remembering that we need to try and tailor these lifestyle interventions as much as possible to that patient sitting in front of you. Offer a range of options, and the more options you have both for dietary and physical activity changes, the better. And finally, just some take-home messages. It's worth remembering that physical activity and exercise are key components of any lifestyle change, not just for improving liver health, but also to support weight loss and reduce the risk of other chronic diseases such as cardiovascular disease and diabetes. It's really important for you to tailor your physical activity and exercise programs to your baseline fitness and your daily routine, and take into consideration your personal preferences, so what you'd like to try and what you're willing to give a go at. And finally, moving more and sitting less is key. If we're thinking about managing NAFLD with physical activity and exercise, it doesn't really matter what type of physical activity or exercise you perform. It's all about finding something you enjoy and doing it on a regular basis in the long term for it to have the most beneficial effects. Thank you.
So, hello to everyone. I'm very happy and grateful for the opportunity to give this talk on the topic of nutrition for non-alcoholic fatty liver disease, prevention and treatment in practice. So, we know by now that nutritional treatment is the most evidence-based treatment for non-alcoholic fatty liver disease. And indeed, we can see that in all guidelines, the European guidelines, the American guidelines, as you can see here, for example, the EASL guidelines state very clearly that the nutritional treatment is the major treatment for NAFLD, and the patient needs to receive structured programs, including lifestyle modification, education, and practical tools how to perform this lifestyle modification. And there is also a clear recommendation for how much weight reduction is needed to treat NAFLD. About 7 to 10% weight loss is needed, and I'm going to discuss it further in this talk. And we know that such weight reduction leads to improvement in liver enzymes and liver histology. But beyond weight reduction, the guidelines also state that there should be modification in the dietary composition, meaning the patients should be advised to eat a healthier diet, meaning less sugar, less saturated fat, less processed food, and more healthier type of foods like the ones characterizing the Mediterranean diet. So now that I have showed you that the guidelines clearly support the importance of nutritional treatment in NAFLD, I'm going to show you the studies to support these guidelines, and I hope I will be able to convince you. So, we know very well, it is very well established, that NAFLD is strongly related with obesity and overweight. And in this figure, you can see that the greater the obesity in different countries, the greater is the prevalence of NAFLD. Well, we know that the prevalence of NAFLD is around 25-30% in the general population, whereas among obese individuals, the prevalence increases to above 50%. And in type 2 diabetes patients, the prevalence increases above 80%. So obesity and type 2 diabetes are major risk factors for NAFLD. And whenever we treat NAFLD with lifestyle modification, we should always remember that we also treat obesity or overweight and type 2 diabetes and other common chronic diseases. So how much weight reduction? As I said, above 5% is recommended weight reduction from initial body weight, and this is supported by this large randomized clinical trial where you can see that a weight reduction of above 5%, something between 5 and 7% of initial weight reduction, leads to NASH resolution, fibrosis regression, and steatosis, which is the liver fat improvement in many of the patients. And the more we reduce weight, the greater is the improvement. If we reduce 7%, there is greater improvement. And if we even reach 10% weight reduction, we get very significant improvement in most patients. However, we know how difficult it is to reach weight reduction. So please remember to tell your patients or to yourself that even 5% weight reduction, which is not impossible to achieve, is very significant for the improvement of the entire spectrum of NASH. And I'm always asked, what should we do with a patient that is not overweight and not obese, is normal weight? So first of all, we need to remember that even if a patient with NAFLD is normal weight, it doesn't mean he doesn't have a belly. It doesn't mean he doesn't have, in more scientific words, visceral fat, which is abdominal fat. And you can see here a control without fatty liver, which is lean, and patient with NAFLD, okay, that is lean, but he has a greater abdominal obesity, greater visceral fat. So that means that even those patients with normal weight should have a small weight reduction, which can be beneficial for them. Something like 3 to 4 kilograms weight reduction within the normal weight may be beneficial for these patients. And in addition to that, they should perform physical activity, since physical activity reduces this abdominal obesity by itself. And they should also improve their dietary composition, since a lot of sugar and fructose in the diet and a lot of cholesterol and saturated fat are unhealthy also for the lean or normal weight NAFLD patients. So we have lifestyle modification even for those NAFLD patients who are not overweight. We need to remember that it's not all about weight reduction, and the dietary composition is also important by itself, and it is related, the diet quality, the macronutrients, the micronutrients, and even the food processing and the food preparation methods matters and has an impact on our metabolic health and also the health of the liver, even independently of weight or weight reduction. And nowadays, a lot of us eat a lot of processed food or ultra-processed food, as you can see in these pictures. And in fact, in different countries, it was demonstrated that about 50% of the daily calories come from ultra-processed food for adults and for children. And ultra-processed food is rich in everything that we don't want. Unhealthy fats, like palm oil fat and saturated fat, and sugars and fructose, and everything that is unhealthy to the liver. So if we reduce the consumption of ultra-processed food, we help the liver too. And what is it, ultra-processed food? Well, it's not a real food. And it actually contains formulations of food substances modified by chemical processes. So it looks differently from the original source of these ingredients. And there's also a lot of addition of cosmetic additives like flavors and colors and so on. And it is designed to be very, very tasty, to encourage us to eat more and more. And how we recognize these foods, it's very easy. Look at the list of ingredients, and you can see that it contains things that you don't recognize, that you don't use usually in your own kitchen. And this is how you know it's an ultra-processed food. And you can see here in a large country from France that a major source of ultra-processed food is sugary products and sugary drinks. About 50% of the ultra-processed food comes from sweets. And in fact, in this study, it was shown that if we increase the proportion of ultra-processed food in our diet, we have increased risk for mortality, cancer, and cardiovascular disease. So we have very good reasons to want to reduce the consumption of ultra-processed foods. And in these very, very nice clinical trials, people were given for 2 weeks either unprocessed food or ultra-processed food diet. And you can see very nicely that, and it was given ad libitum, meaning they could eat as much as they want. And you can see that those who were having the ultra-processed food diet were eating much more calories and gained weight during these 2 weeks of eating ultra-processed food, unlike those eating unprocessed food. And so the authors of this study state that limiting the consumption of ultra-processed food may be an effective strategy to obesity prevention and treatment. And going back specifically to the liver, in one of our studies we have shown that high consumption of red and processed meat is directly associated with non-alcoholic fatty liver disease and with insulin resistance, which is a key factor in the pathogenesis of non-alcoholic fatty liver disease. Why? Because meat and processed meat contain a lot of additives, sodium, preservatives, saturated fat, and cholesterol, probably. And also the way we prepare meat is important. If we fry the meat or prepare it to a level of very well done, meaning that it's a little bit burned, then it makes more harm. It's more harmful. So why is that? Probably because that when we burn the meat, we create all kinds of compounds called heterocyclic amines and advanced glycation end products, which are pro-inflammatory and therefore increase inflammation and insulin resistance. So remember, do not eat a lot of red and processed meat, especially not processed meat. And when you prepare it, try not to burn it too much to a level of very well done, because it's also unhealthy. What about saturated fat? There are so many studies showing that saturated fat is unhealthy for NAFLD. And this is just one example of many. In this study, people were provided for 3 weeks with butter or unsaturated fat or simple sugars. And you can see here the amount of liver fat increasing with the intake of saturated fat. It did not increase with the intake of unsaturated fat, and it increased less dramatically with the intake of simple sugars. So saturated fat is also unhealthy for the liver. Sugar is a major dietary component strongly related with non-alcoholic fatty liver disease. And let me just remind you that the sugar that you're familiar with, the white sugar, contains 50% glucose and 50% of fructose. And why is it important? Because specifically fructose increases liver fat. It reaches the liver and turns into fat very quickly. And where do we get fructose from? We get it from fruit, but we don't get many fructose from fruit. So you can keep on eating fruit actually. But the major source of fructose in the diet is actually added sugar. Added sugar is sugar added by the food industry to our foods. So if you reduce industrialized food, ultra-processed food, you will reduce also your intake of fructose. And another major source of fructose is sugar beverages. which is highly unrecommended to patients with NAFLD. It is strongly associated with cardiovascular disease, type 2 diabetes, obesity, and also non-alcoholic fatty liver disease. And indeed, the American Heart Association and the WHO all recommend to limit sugar consumption to 5 teaspoons per day for women and 9 teaspoons per day for men. But if you have just 1 can of sugar beverages a day, then you already reached 8 teaspoons a day of sugar. So if you have even 1 can of sugar beverage per day, it will be impossible to keep up with the recommendations. And that is why we need to avoid completely soft drinks, because there is also a lot of sugar hidden in your foods that you don't know about it. And it would be impossible not to overeat sugar if you had drink soft drinks. And if you want to look at children and adolescents, so it's amazing. These are global data, world data, and you can see that about 25% of the children and adolescents in the world, in Europe and in other countries, consume at least 1 soft drink on a daily basis. So we should really be careful with children and adolescents in terms of consumption of soft drinks. We should really try and reduce it. Otherwise, we will have a generation with a lot of chronic diseases, including non-alcoholic fatty liver disease. And if you take children and you tell them, hey, try to reduce the sugar from your diet, and you provide them meals without sugar. So here you can see the individual reductions in liver fat. You can see that those children reduce quite quickly. In a couple of weeks, they reduce the amount of liver fat, and they reduce the amount of the ALT levels in their blood samples. Well, something that did not happen in the control group. So if we reduce the sugar, very quickly there is a positive reaction in terms of improvement of the amount of liver fat. And it is not surprising that the American Academy of Pediatrics strongly recommends to limit sugar consumption among children. It is if they state that it is harmful, possesses health threat to children, and it is actually affecting more low-income communities. So we should really pay attention to low-income children in terms of education for sugar reduction. What should we be eating? So this is a very, very nice publication from the Eat Lancet Commission, published in 2019, showing us what is a healthy plate. And please notice a lot of vegetables, of course. It looks very much similar to Mediterranean type of diet. And you can see very, very small consumption of meat, red meat and processed meat. And of course, they recommend whole grain consumption, unlike refined grains. And of course, minimal amount, if any, of sugar. And I just want to tell you that if you eat a healthy diet, if you have a kind of Mediterranean diet and you don't eat a lot of saturated fat and sugar and reduce cholesterol intake and red and processed meat intake, and have a lot of vegetables, fish, do physical activity, have olive oil, and also drink coffee, by the way, which is helpful. You won't only reduce the amount of liver fat and liver damage, you will also probably reduce the risk to develop liver cancer. So all these dietary modifications are also important for the prevention of liver cancer. So how to implement lifestyle modification? This is challenging. And as you can see in this figure, it's very complicated. We tried in one of our studies to realize what should we tell the patients if we want to get their adherence to lifestyle modification. But I can tell you what we learned from this very complex figure. We learned that patients want to understand the disease. We need to explain what is NAFLD to the patients, and very importantly to say that NAFLD is treatable by diet. We can reverse steatosis, we can reverse non-alcoholic steatohepatitis, the more advanced inflammatory form, and even reverse fibrosis, as I have shown you. So it is very cost-effective to change lifestyle, in fact. And we need to provide information to patients how to do it. And we need to enhance patients with self-efficacy, giving them the feeling that they can actually do it. It's not that bad. It's just 5% weight reduction. You don't need to reduce 20 kilograms. You need to reduce 5 kilograms. It's fantastic. If you improve your dietary composition, it's great. If you manage to walk 3 times a week for an hour, then it's great. So every improvement is important, not just weight reduction. And so we don't need to put all the focus on weight reduction, although it's important, but it's not the only thing that is important. Every modification in lifestyle towards a healthier lifestyle is really important. And we should set realistic goals for weight reduction. As I said, it can be minor or minimal weight reduction, and it is still beneficial for non-alcoholic fatty liver disease. And every successful lifestyle modification combines these things. This is obtained from the obesity treatment guidelines. We need to combine behavioral therapy, like self-monitoring. It's having a food diary, for example, realistic goal setting, stimulus control, like not having sweets and the best tasty cakes in the house because we probably won't be strong enough and eventually end up eating it. So please keep it out of your houses. Also soft drinks. We need to provide diets as detailed and tailored for the patient as possible. And of course, always combined with physical activity. And this is a summary of the lifestyle treatment across the course of NAFLD. If we want to treat steatosis, we can have dietary modification towards a healthier diet and physical activity, and the steatosis, the liver fat will improve even without weight reduction. If we have a more advanced form of liver disease with inflammation and fibrosis, then we would have to change the diet, but also to get certain weight reduction to reach an improvement of about 7 to 10% weight reduction. And even if there is the very advanced form of liver disease of cirrhosis, it is not always reversible, but we need to remember that there's a lot we can do to keep the liver as healthy as possible, and also healthy diet and lifestyle prevent liver cancer, which is very important at the level of cirrhosis. So please remember that dietary modification is important at any stage of the disease. And with that note, I thank you very much for the opportunity to give you this important talk, and I would be very happy to answer your questions. Thank you very much.